the EDI Lead Midwife, so that's Equality, Diversity and Inclusion. And today we'll be talking to you about maternity care in Wolverhampton. So, have you recently had a baby? Are you planning a pregnancy? Or are you pregnant? So, just with those few things in mind, we will be going through what will happen to you in maternity. And I've brought with me today one of my colleagues. Her name is Amanda Costello, and she's our public health specialist midwife. Amanda, can you kindly introduce yourself to us and tell us a little bit more about your role?
Hi, yes, as Sunita says, I'm Amanda and I'm a public health midwife, and it's a very broad role, and if you speak to public health midwives around the country, we all do something slightly different, but in my role I am responsible for the healthy pregnancy team, who are an amazing group of women, and the tobacco dependency service, and oversee vaccinations, maternal vaccinations, and anything else that comes up that might be related to public health.
So, how long have you been a midwife?
Golly, more than 30 years. Yes, I think it might even be coming up to 35 years, which is a scary thought.
Oh wow, that's amazing. You must have seen lots of changes over the years.
Yes, but as myself and a colleague who's been around almost as long as I have was saying the other day, if you stand still long enough, everything comes around.
Yeah, we do see that.
Yes, yeah.
The voice does often change, but it's always keeping the mother and the baby at the heart of healthcare. So, tell me more about this healthy pregnancy team. Who are they? How do they get referred? What happens with the healthy pregnancy team?
Okay, so the team are, as I say, 5 amazing women. I will name them. There's Shani, Zoe, Amanda, Dee and Emily, and they have got multiple, amongst them they've got lots of different experiences and they work in different ways. They're all tobacco dependency advisors, so they can support anybody, any mother with support to quit smoking. But they also focus on things around knowing about diet and nutrition in pregnancy, the importance of safe exercise, the importance that we keep exercising during pregnancy, that we don't sort of stop doing those kind of things because it's harder to start again. They are based at Wensfield Library, but they work across the whole city. They run groups, so there's a group that runs at the Molyneux once a week, so that anybody can drop into that group. They also run early pregnancy antenatal classes, so when you're first pregnant, and anybody who's been pregnant recently will know this, you meet with a midwife and you have a long booking and you talk about, you know, your health and your family's health and all sorts of things, and you get given an awful lot of information. And the reason for doing these antenatal classes is to go back over that information, because you might have more questions, or at some point you've been told so much that you zone out. Yes, so they do that. They visit people who can't get out, and they'll visit them in the homes. Tend to encourage people to come in and join groups because of the social interaction that's important. Yes. Yeah. So one of the things they do, they work with the healthy minds. It's not healthy minds. The maternal support team at the local authority on these guided walks. So that's a good way in pregnancy of getting your exercise, but also meeting up with people and having a chat and talking about, you know, things health related, but also things that are just in your mind at the time.
So if somebody needed to access the healthy pregnancy team, how would they do that? Can they refer themselves? Do they just turn up? Is it a walk-in service? Can you just tell us a little bit about how they would access that support?
Okay, there are a number of ways in which you can be referred. You could ask your community midwife. You could say, I've heard about the healthy pregnancy service. Can you refer me? The community midwife might actually say, you know, it'd be ideal for you to be referred to this service. Or you can self-refer. So you can contact the team. So quick warning, if you need a pen and paper, get it now, because I'm going to give long telephone numbers and an email. So you can contact on either 07811 524275 or 0778 07285 463, or by email, which is rwh-tr.healthy-pregnancy-team@nhs.net. Not the shortest email address, but there you are. The other way in which you could find out more information is every 6 months or so we hold a healthy pregnancy event at the Molineux, and the next one is on Thursday the 30th of April at the North Stand at the Molineux, from 5:30 in the evening till 7 o'clock. So anybody who is pregnant or is thinking about pregnancy, or is supporting somebody who's pregnant, so partners, relatives, anybody can come along and find out more information then. But we'll probably talk about that a bit more in the...
Yeah, we'll go on to that later. So do you have to be a certain number of weeks to access
No.
the healthy pregnancy
No.
team?
From the minute you're booked, you can access the service, and actually, in many ways, because we're talking about things about making sure that we are having a healthy weight and diet and exercise and the social networks that are available, the sooner the better, really.
Yeah, that's great. So one of the other things that do sometimes cause concern in pregnancy is often smoking, and that does lead to its own concerns in pregnancy. So can you tell us a little bit more about the effect of smoking in pregnancy, please, Amanda?
Okay, so the harmful thing around smoking is the carbon monoxide. So every cigarette that you light, or anybody who lights around you, they're breathing out carbon monoxide, and that's what causes the harm. So it stops the placenta working efficiently, so people that smoke or are in environments with a lot of other people are smoking and they're getting this carbon monoxide are more likely to their babies not to grow as you would expect them to, for the babies to be born prematurely, for the babies to be more likely to develop things like asthma and have some learning difficulties later on, and sadly the saddest thing is that especially in Wolverhampton, if you smoke, your baby is more likely to be born sleeping than if you don't smoke.
And if a lady was pregnant and she was smoking, what support would be offered to her?
Okay, I think the first thing that we need to say and recognise that many people think that smoking is a lifestyle choice, and it isn't. Where it depends very much about where you live, who the people you're working with, you're living with. In certain areas of Wolverhampton, that you are more likely to smoke than others. So it's it's in the system almost. Yes, yeah, and the other thing, which is I think is a very cruel thing, is that when you're pregnant, the need for the nicotine is stronger than when you're not pregnant. So what we know is that stopping smoking is not going to be easy. So that is why the support is really, really vital that it's there. And with the support, with the right support, more women stop smoking than don't. So it's really worth going down that pathway. And there are a number of ways in which you can change and wean yourself off the nicotine, because that's the thing that you're addicted to. Some people switch from smoking cigarettes to vaping. The current advice is, if you don't smoke, don't vape. But if you do smoke, consider swapping to vaping as a safer alternative. So we do know that vaping is not without its risk, but it's safer than smoking because you won't get the carbon monoxide to the baby. But otherwise, there are nicotine replacement therapies, which I suppose is what vaping is. So there's patches, there's gum. There are other things that you can use. But the important thing is, like anybody who's done any of these things, you need your champions around you. You need somebody who understands what you're going through and has the experience of pointing you in the right direction and guiding you, especially in the moments where, if you're a smoker, and I'm very lucky, I've never smoked, But I know smokers who get this craving that, you know, this is the moment I need to pick up a cigarette. If you can have that contact, even if it's a text message going, help, I want a cigarette now, something to distract you. So the team will support in all sorts of ways. They will help you over your concerns and your wobbles, really.
Yeah. So would you look at the whole family, because often it's things like stress that do cause that want and that need for a cigarette. So I've definitely met ladies when I've seen them in the community, and they've often told me that actually then it's not just themselves that are accessing smoking cessation support, it's sometimes a partner as well.
Yes.
So
Yeah.
does that support reach out and extend to family members?
It does, in the terms of the support, in terms of like, this is a great thing and we will support you, but in terms of access to nicotine replacement therapies, most families will have to either buy their own, or there is the Wolverhampton service that you can be referred to. But you know, what we do know is that if anybody around you also supports you in that quit attempt, you are more likely to succeed.
Strength in numbers.
Yes, and the government recognises this, and there are a couple of incentive schemes, and one of them we've only launched in Wolverhampton literally yesterday. So one of the incentive schemes is that, you know, if you can set a quit date, and if you can remain smoke-free, and the longer you are smoke-free, the more likely you are to be smoke-free in the future, you will get an incentive payment. It's quite strict criteria. You know, you can fall off the wagon once, but you can't fall off it twice and still expect to receive the incentives. And as I say, the government recognises the import of family support. So now there's the significant other. So if you have, you know, your partner or another family member, you can only pick one person, or even a close friend who can come on that journey with you. There will also be incentives for them, so long as the pregnant person remains smoke-free and the other person is smoke-free. And we verify it by asking people to blow a carbon monoxide reading. So anybody who's been pregnant will have had that at booking.
That's incredible. I mean, that is really brand new.
Yeah.
I didn't know about that before.
Yeah.
I think the other thing is we do monitor the CR reading. So when you do go for your normal community midwife appointments, you will be asked to blow into a CR monitor. And if the reading is above 4, even if you say you don't smoke, that still warrants a referral and
Yes.
doesn't sit to the smoking cessation.
And the team will come along and talk to you. And if everybody in the family is smoke-free, advice around checking your boiler. Interestingly, candles. You know, some people have a very luxurious bath and light every candle around. If you're only doing that once in a blue moon, that's fine. But you know, if that could be a reason for blowing up.
What about incense sticks? Do those make a difference?
Anything that generates carbon monoxide.
Okay.
So anything that's burning.
Yeah,
Yes.
you wouldn't think of simple
No,
things that you
no.
might practice at home.
Yeah.
That could increase your
Yeah.
carbon monoxide.
Yeah.
And do you think pollution as well outside?
Yes, so there is some. You know, if you've walked there and it's a longer, you know, so if you're on the scheme, make sure you don't walk down this busy A road as you're coming into us.
Oh, that's really useful advice. What if somebody doesn't smoke themselves, but it's their family members that smoke? Would that also increase their carbon monoxide reading? Or
Yes.
the lack of the support, is that still extended to family members if the pregnant lady herself doesn't?
Yes, as I say, the support will be different and what's available, but yes, there is that support there, because we do know it's the carbon monoxide, and that increases the risk, you know, of as I say, stillbirth and small babies, preterm labours, things that, you know, nobody wants happening to them. So yeah, it's important. It's important for our children to be born in smoke-free homes.
Yes, definitely. I've been into houses and sometimes families do say that they don't smoke, but you can definitely smell smoke. So somebody in the house clearly does. It's just that education
Yes.
about passive smoking, isn't it?
Yeah. Yeah.
Difference.
And some people think, you know, going into another room, but it's still on your clothes. It's still there.
It's on your breath. It's on
Yeah.
your skin, isn't it?
Yeah.
So the advice for people that do smoke at home, what would you advise them to do?
Seek support to quit.
Yes.
Having said that, I know that is not an easy option, and everybody will understand that's hard, but it is really important. And you know, a pregnancy might be your motivation. That might be the thing that drives you to quit. But if if you can't, then ask that people don't pick up the baby if they smoke, that they wait 30 minutes after having had a cigarette, that they wash their hands. Smoke outside. Don't smoke in the house with the baby, no.
Okay, so we've covered smoking, we've had a look at your role, and we've also looked at how that people can refer themselves to the Healthy Pregnancy team. So I just want to talk now about preconception care. So before a lady becomes pregnant, or perhaps she's planning a pregnancy, or they've been trying to conceive for some time, can you just give us some insight into that preconception care? What people should be doing, what they should be accessing, where can they go for information and advice?
Okay, so I suppose first off, if you've got any condition, if you have diabetes or a family history of diabetes, any other chronic condition, then you need to speak to your health professional, so your doctor or your consultant under your care, about timing this pregnancy. But on the whole, for all of us, and this applies to everybody, whether you're thinking about pregnancy or not, we do know the health benefits of maintaining a healthy weight. So have a look at your weight. At the moment, in the last 10 years, the number of us as a population who are overweight or obese has increased, and that has, lots of people will be overweight and obese and have a perfectly healthy, happy pregnancy, but it does increase risks. So
it's that added complexity, isn't it, really, with the care and measuring the baby later on when we start to measure. If your BMI is high, it's difficult, it's harder to measure with the tape measure, so then you'd need additional scans in pregnancy. You'd need to be consultant-led care rather than just be midwifery-led care. So it does really have a lot of implications.
And puts you at higher risk of gestational diabetes and then type 2 diabetes. So definitely look at your health. Look at your family's health. It's a time when the whole family can get together. Replacing highly processed foods. Looking at things and there's lots of advice and information out there about the healthy foods and how we have a diet that is mixed and balanced, full of fresh fruit and vegetables, frozen vegetables, tinned fruit and vegetables.
It can be quite expensive, can't it?
It can be, but there are ways around looking at how you can do this.
So we can talk about the Healthy Start vouchers as part of the scheme that's by the government. So it is means tested, isn't it?
Yes.
If you qualify for that, then you get vouchers and you can use them in your supermarkets to help you purchase fresh fruit and vegetables.
Yes.
And that will help you control your BMI.
Yeah.
That's one way of doing it. Generally, just the way you cook as well, so trying to boil, steam, bake rather than fry food, that makes a huge difference. Even if it's frozen food, sometimes a lot of people do still fry food, whereas you can choose to bake or put things in the oven or steam. There's different ways of cooking food. So with the preconception care, how important do you think pregnancy multivitamins are?
Well, we know they're very important. We know the importance of taking folic acid, as you're thinking of conceiving, reducing the risk of spinal cord problems for your baby. So folic acid, definitely. Vitamin D, these are in Healthy Start vitamins, but vitamin D we know helps support our immune systems, helps us be healthier. And we've had a very dark and wet winter, so for all of us, our vitamin D levels are not going to be as high as we would want them to be. So definitely, if you're pregnant during winter, you need your vitamin D and beyond.
And sometimes ladies often vomit, don't they, in pregnancy? They have morning sickness, which we know isn't actually morning sickness. It can be any time of the day or the night. But sometimes when you're vomiting, you're not always absorbing all the nutrients from food.
No.
So having a pregnancy multivitamin will help just to top up your balance really that you need in pregnancy.
And the nausea is really hard. Again, the healthy pregnancy team would be able to give you lots of advice about managing nausea, because one of the strange things about nausea is you suddenly want to eat things and eat more, and it might not be the thing that's the best for you. So about managing that and what you could eat.
Do you have a top tip for nausea? Do you
recommend
anything that listeners might really find beneficial?
A lot of people recommend ginger.
Yeah, I've heard that one.
So and then try and avoid things like ginger biscuits because they're going to be high in sugar, or make your own, and maybe use things like dates to sweeten, so you're getting
no sugar biscuits,
yes,
rich tea or arrowroot.
Yeah.
When I did my training years ago, that's what my midwife always used to tell all the women, was always make sure you've got rich tea next to you when you wake up, and it stops that nausea.
Yeah.
And people would come back and they'd say,
Yeah.
"Well, try that, it was quite helpful."
Yeah. Or dry, if somebody's kind, the really kind people around, making you a nice piece of toast in the morning.
Yes.
And even dry toast can be the thing. So eating quite early, taking sips, eating small amounts.
Just keep your fluids up as well, I
Yeah.
think, because if you're not managing to eat, it's really important that we don't become dehydrated. So keeping on top of your fluids and having sips of water throughout the day will definitely help. Yeah. So, regarding pregnancy multivitamins, do you think there's a particular time that people should take them? Do you recommend they should be in the morning or in the evening, or does it not matter?
I think I would say take them when you remember. You know you're going to remember to take them. So if it's you put the kettle on and that's when you're going to take them. If it's just before you brush your teeth, take them. It's getting in the habit of remembering to take them every day. So find your best way. But ideally, first thing in the morning is a good time to take tablets.
And I think I've had ladies that say that the tablet's quite big, or it just makes them feel sick. The tablet itself doesn't suit them. So for those ladies, one thing you can try is having it at night before you go to bed, because even if you are feeling a bit nauseous, you will hopefully be asleep, so it shouldn't affect you too much. But yeah, whatever works for you. As long as you're taking it every day, that's the main thing. Okay, so the preconception care, although we're giving the advice, is there anywhere that women can go or families can go if they wanted to access some preconception care?
As I say, first of all, you could go to your GP, but there are also groups that are run monthly. The next group that's running is on Saturday the 28th of March between 11 and 12:30 at the Bingley Family Hub on Norfolk Road in Penfields. So there you could go along and you could find out information about, as we've just been discussing some of these things, but also, how to book on into your pregnancy, what to expect, what will happen. Some people, it might be that they're struggling to get pregnant, so it might be about health and things like that. But if you've got any other concerns, then you need to see the GP.
It's a point for a quick check-in, isn't it? If you've got any concerns about pregnancy, if you're taking any medication that you feel that you need to stop, you might just want to get some advice on that, because sometimes you don't need to stop your medication just because you're pregnant, because it may affect the health condition that you're taking that medication for. For example, mental health, it could be antidepressants. We'd need you to continue them. Only stop your medication under the advice of a doctor or your GP. So that's quite important, not to stop any medication unless you've been medically advised. But coming along to those preconception, those prenatal sessions, that is somewhere that women can go to. Just to talk about things, if you've got any concerns, you can discuss them with midwives that are there and just get some advice. Okay, so we will be shortly going to a break and then we'll continue our conversation. How have you found that this morning, this afternoon? Sorry,
This afternoon, the day's flown by, hasn't it?
That's gone quick, hasn't it?
Yeah.
So we'll speak to you shortly after the break where we'll continue our conversation. welcome back. This is Maternity Matters. I'm Sunita Banga and I'm joined today by Amanda Costello. We are both midwives and Amanda's our guest today. She's a public health specialist midwife and we're just talking about pregnancy and that first 1001 days, which is from conception up until the child is 2 years old. Amanda, can I ask you about contraception, which seems like an odd thing to be asking or talking about when we're talking about pregnancy, but it is something that we take quite seriously. It should be considered in the pregnancy. What are we doing at Wolverhampton for contraception?
Okay, yes, you're right. It does feel strange for us as midwives to be talking about contraception, but what we do know is that spacing children is healthier for the mother, but and also for the second baby or third baby or whatever. So, babies that are with a longer space of more than a year are more likely to grow as we'd expect them to. So we take contraception quite seriously, and you will get asked about it during your pregnancy, and again once you've had the baby. And there are a number of considerations and options that are available to women. You may get asked if you're having a planned caesarean section. You may be asked if you want a coil fitted at that point, and some women choose that. You may, the other options that we can make sure that you either go home with or with a plan for is the progesterone-only pill. Your midwife who's discharging you from hospital can give you a supply that you would start taking from the 21 days after the birth of your baby. If you delay it by more than 21 days, you'd need to find another form of contraception to use as well. There is also, I can never pronounce this, the Depo-Provera injection. Thank you. That's available. That's a one-off injection. Well, not one-off. You need to repeat it in 13 weeks' time. But again, that would work. There's implants that you could be asked to come back to return for an appointment. So you will get asked those questions, and I think one of the things, all of us as midwives, if we raise this question with somebody who's had a baby, they tend to say, never again, I'm not doing it at that point, or no way. But being aware that you are very, very fertile when you've just had a baby, even if it's taken you a while to get pregnant the first time.
You shouldn't make that assumption.
Yes.
That there's going to be that difference.
Yes. We know lots of people that even had fertility treatment with their first child and then 10 months later have the second because they were so surprised. They weren't expecting to get pregnant so quickly.
It does happen.
Yeah.
Also, what about breastfeeding? So if our mums are leaving the hospital and they're breastfeeding and they may be worried about taking the pill.
Okay. Progesterone only pill is safe with breastfeeding. All those forms of contraception are safe. One of the questions we sometimes get asked is breastfeeding an effective form of contraception? And the answer is yes, and like with all form of contraception, so long as it's done optimally. So if for any reason you just like if you missed one of your progesterone-only pills, but if you miss a breastfeed, or you go away for a night and you don't express and you're not feeding as regularly, or your baby stops feeding for long periods of time, then that means that you're more likely, your fertility is likely to increase. So, it can suppress ovulation, but only if you're breastfeeding exclusively without giving any other feeds to the baby. So that's the thing to bear in mind. And also, the minute your baby starts having other foods and starts spacing the feeds, that is a time when you're more likely to get pregnant. Yes.
Some women do use that as a form of contraception, but it's very important to consider if you become unwell yourself as well. Maybe you're on antibiotics, or if you've not fed as regularly, like Amanda said. It's really important if you're using that as a method of contraception that you must do it exclusively and regularly. Otherwise, there is always that risk, that chance that you can become pregnant.
I mean, around the world, in other areas, years and years ago, I heard an Australian man talk about a group, an Aboriginal group in Australia, where they were looking at the spacing of the children, and the children were spaced, 5-6 years apart. and they felt there must be something going on with this group. This can't be natural. This can't be normal. But the children were co-sleeping with the family. That was the safe thing to do with the other predators that might be around, and were continuing to breastfeed throughout the night. And actually that was helping natural spacing. So, it does work in some instances, but, with it is about that exclusivity.
Yeah, I think it's one that you really have to be careful with if that's what you're choosing.
Yes, yeah.
A lot of people often say as well that they're just abstaining, they're just not going to
Yeah.
have intercourse, but it's not worth the risk really. If you are, or if it's unplanned, just make sure you're using a barrier method or using something on those occasions where you haven't got more of a permanent solution really.
Yeah.
available
If you
for
miss
contraception.
your pill, or you don't take it every morning or whatever it is, just be aware that you will need to use another method. Yes.
I think in antenatal classes we do talk about contraception, and most families are quite confused, thinking, oh, we've come here to learn about how a baby is born, antenatal classes, and now you're talking about contraception. But we just need you to be considering it and make those decisions really. Often women sometimes say as well that they're planning on their husband or partner getting a vasectomy, but unless that's arranged and those appointments are all put in place, or there's a delay, again, you still need to consider something for that period of time up until that vasectomy takes place.
Yeah.
So, shall we move on to vaccinations? What do we offer in pregnancy, and more importantly, why?
Okay, throughout the year, we offer the vaccination against whooping cough, and that is because it provides immunity to the baby to be born, and it's given around 20 weeks so that you get the optimum immunity up until the point when the baby would naturally have their vaccinations. Babies have got an immature immune system, so they're more vulnerable. So whooping cough is offered. So what most people find is when they come for their 20 weeks scan, which is the detailed scan that you're offered at 20 weeks, around about that time they have their whooping cough vaccination. If you come to antenatal clinic and there isn't somebody there to give you the vaccine at that point, you can arrange to come back, and we do some twilight clinics at New Cross in the week. Again, check in first, don't turn up. But if you have booked an appointment, literally coming in for a vaccination takes 5 minutes. So we've arranged with parking that it's free parking if you're just coming in and out at that point. And then the other vaccination, which has been spread across England for at least around about 18 months, so September 2024 it was introduced, is the RSV vaccine, which is respiratory syncytial virus. And that is, that is a common virus that is circulating in the population. And for me and you and anybody else who got it, we'd have a bit of a runny nose, we'd feel a bit rough, but actually we would recover quite quickly. But babies with their immature immune system, and elderly people, so it's often people over 75 as well, whose immune systems can't take that challenge quite so well. And it's really important because RSV is like, for newborn babies can lead to hospital admission. Some babies end up in intensive care, and very, very sadly some babies die. It's a safe vaccine for women to have in the pregnancy. Like all the vaccines, they've been well researched. They've been given around the world, and in this country we've been given the whooping cough and flu vaccine for a long time. RSV has been given in the States for years, so it's one that the paediatricians really, really argued that with this would help our babies, because often children's wards in winter are full of babies with RSV.
It's those admissions, isn't it?
Yes.
Bronchiolitis, pneumonia, those respiratory conditions, so it just reduces those.
So the RSV, again, so that it will work in the best way for the baby, is given after 28 weeks pregnant. So as close to 28 weeks pregnant as you can have it. Again, your community midwife will make you a referral for it, or you can drop in at the antenatal clinic if you're coming for another reason after 28 weeks. Or you can phone the clinic and just say, can I pop in and do this? So, it's one that's really, really important. GP practices will give you RSV as well. And then during the winter months, the very important one is the flu vaccine. And for pregnant women, they start it early. You start the vaccination from September. So everybody who is still pregnant on the 1st of September, early days of September, I'm just thinking if the 1st of September is a Saturday, that might not work that way, but early days of September will be offered the flu vaccination. So at any point in the pregnancy. And again, that is to protect the baby, but also women when they're pregnant, their immune system is slightly suppressed and they're more susceptible to illness. And flu can makes all of us very ill if we get it, but can make you feel even worse and high risk of being admitted to intensive care and needing extra support with breathing. So it's for the baby, but also for the mother. To make sure. And what we found last year with the women that did have flu during, who hadn't had the women that had admitted to a hospital with flu and had a positive, confirmed case of flu, all but one of them had not had the flu vaccination. And if you have the flu vaccination, like a lot of vaccinations, you may not. So with the flu vaccine, you may still get flu, but you won't suffer the symptoms in the same way. So
as unwell.
Yes, yeah,
as you would be without it.
Yeah.
I think it's important to mention that women from a black, Asian or minority ethnic background, they're more at risk as well. Their immunity is lower. So if you are from one of those backgrounds, definitely consider having the flu vaccine. It's really important. It's important for all pregnant women.
Yeah.
But if you're from particular groups, or if you've got other health conditions, if you're diabetic, if you've got blood pressure problems, if you've got other health problems, you do not want the flu on top of what you're already suffering with.
Yeah, and you don't know when it's going to hit you. And this year the flu was circulating very early in the year. Quite commonly, it spreads really, really quickly over Christmas when people are travelling around and socialising. Yes, yeah. So
if you can protect yourself and protect your baby, that's
so.
a wise decision.
The flu vaccine is available from early September until the end of March. So if you're pregnant now and you haven't had your flu vaccine, you can either speak to your GP or drop into antenatal clinic where the lovely people, the lovely vaccinators there will give you.
Can you tell me if somebody doesn't have their whooping cough or RSV at that time where we recommend that they should be taken, can they have them done afterwards? So let's say it's the whooping cough and the lady wasn't sure at 20 weeks when she's coming for a scan. If she wants to have it later on, is there still an opportunity for her to have it later on?
Yes. I mean, we recommend those times. Those times are to give the optimum benefit to the baby. But, again, anything that protects the baby from these infections. And if she's breastfeeding, she's going to be protecting that baby. So those antibodies will be there in her breast milk to protect her baby as well.
Okay, so one of the things that you mentioned earlier on was that your Healthy Pregnancy team do healthy pregnancy events, and we've done them in the past. I've been there myself. They've been really well attended, brilliant events. Can you tell us about the next one, please, and who will be there and what people can expect to find at the Healthy Pregnancy event?
Okay, great. So we do this in partnership with the Wolves Foundation. So we hold the events at the Molineux and with support from the Wolves Foundation. It's been the most sort of joyous bit of partnership work I've done that I've been involved with. And we invite anybody who might be there or in any part of a pregnancy journey. So we have the digital midwife team who are there, who you can talk to about your Badgernet app. So if you're pregnant, you know what I'm talking about. If you don't, you've got that to find out about. We have the Healthy Pregnancy team there, again, who will talk about diet and exercise and what's available there. We have the pelvic health team. They come in and they talk about the importance of protecting our pelvic floors and what we can do there. The tobacco dependency advice is there. Neonatal team to talk about, health visitors, parent champions.
Maternity, neonatal and voice partnerships there.
Yes,
talk to them about sharing your experiences.
Yes, and learning more and contributing. And the neonatal the dental support as well. So talking, because dental health is really important in pregnancy, and talking about that is really clear. And I suppose on that note, you've just mentioned the Maternity Neonatal Voices Partnership. The next meeting is on Wednesday the 25th, held at the Central Bus, I call them.
Swimming and Fitness Centre, that's next week, isn't it?
Yes,
On the Wednesday.
yeah. And that will be an opportunity, particularly if you already had a baby or you're expecting to have a baby by caesarean section, but please come along anyway. But we're talking about the caesarean section pathway. So anybody who's had a caesarean section, we know we could, we're all doing our best, and we're trying to, we know it's a safe service, but how could we do it better? What kind of things could we do to make this experience better for women and families? So we want to do some work with people that have used the service who can point out the bits that would help them and make things easier for them.
That starts at 10 o'clock, is it 10:30?
Ooh,
I'm going to say 10.
It's on social media.
Yeah,
Sunita
there
is,
are posters
yes, Sunita will be posting it, so
Mm.
follow Sunita.
No,
I say that as if I know what I'm talking about. I know nothing about
it's
social
a really
media.
good opportunity for you to come along and talk to staff and talk to other parents who've got shared or similar experiences.
Yes.
They're often really good. I just want to go back to the dental care that you mentioned. Ladies, do make sure you've got your free prescriptions form sorted out in pregnancy, so you can get that from your midwife. It's called the FW8 or your maternity exemption form, and it's completed in pregnancy, ideally at your booking or possibly your 16-week appointment, but that will entitle you for free dental care and free prescriptions for the whole of your pregnancy and for 1 year after, so don't miss out. I just thought I'd mention that because we're
Yes,
talking about dental care.
definitely, that's really good. And make sure you get it, because if you say you are entitled to free dental care and you haven't got the certificate, you will get fined.
You get a fine and you have to pay the prescription.
Yeah,
You have to, I have known ladies to appeal it, but it's a lot of,
yeah, it's a stress. Stress you
it's a
don't need. Yeah, yeah.
It's a headache. Can we just go back to talking more about exercise in pregnancy? Which exercises would you recommend that pregnant women?
I think it depends very much what you've been doing previously. So if you're a long distance marathon runner, perhaps don't go for your PB all the time, but you've got your you've got a level of fitness that you can do that. If you haven't, if your exercise generally was going to the gym, just make sure you're doing exercises to protect the bump. Perhaps don't start rugby or anything physical.
Amanda, that's been really helpful. Thank you so much for coming in and joining me on Iman 1, and it's been really lovely to talk to you, and I hope all our listeners have enjoyed that too.
Thank you.